Hello, my name is Lachey, and today I'm going to demonstrate the AccuCheck. Before we begin, I'm always going to check the MAR to make sure that I'm going to get the AccuCheck for the right client. I'll begin by performing hand hygiene. Room, ask them to verify their name, date of birth. I'm going to assess the client's finger. I'm going to make sure that her fingers are nice and warm. I'm also going to ask her which preference. Don my gloves. Now that I've donned my gloves, I want to make sure that I'm checking the expiration date on the strips. And then I can also scan her wristband, and I could also scan the strips to make sure that these are the right strips. So just say that I've scanned those. I will then place the strip in, and once I heard the beep, I know that it is now on. The patient, before we do this, we're going to make sure that we clean the finger off, okay, making sure that it dries before we complete the acupuncture. We're then going to take our lances and puncture her finger. We want to make sure that we puncture it on the side and not the finger pad, because it has nerve endings which would cause more pain. Okay, this can go into the sharps container, but for now we're going to put it here so that way I don't contaminate. Okay, that first drop of blood, we can just gently milk the finger. So we have our first drop of blood there, and with that we're going to wipe the first drop of blood, gently press again to get a little bit more blood. Then we're going to place the blood at the end of the strip, allowing the strip to suck the blood. Give the patient a cotton ball finger. Okay, blood glucose level is at 97 milligrams per deciliter. And once we have done that, we can then document. Now once we have done that and we've documented, I can go ahead and place the lancet into the sharps container. Okay, wash my hands. I would also clean off the monitor. So just say that this is one of the facility's cleaning wipes that they provide. Documented, I've washed my hands, and that will be the end of this video. Again, I've checked the medication administration record to make sure that I have the right client, the right dose, the right route, the right time, and the right indication. I've also checked the client's blood glucose level, and based on this sliding scale, she's going to need 15 units. Okay, so cleaning this off for 30 seconds. Cleaning this one off for 30 seconds. So we are going to make sure that we have checked the expiration date on these. They're not expired. We're also going to roll them for a few seconds. Okay, we're going to inject the total amount of air, which is 15 units of air. 15 units. Okay, we're going to go into the cloudy first, injecting 10 units, making sure that we're going straight down, not bending the needle. 10 units. Okay, then the remaining air goes into the regular, not bending. Okay, then we can pull 5 units of NPH. Okay, I would check this with the nurse to make sure that it is 5 units, and she will be standing right by me. I'm also using a new cotton swab, keeping the needle away from me, cleaning this off for 30 seconds. Okay, and then we're going to get the remaining amount, which is 10 units, into 15 units, making sure that we do not aspirate. Okay, and then I could recap this needle from going into the client's room. And I've also checked with my nurse to make sure that that is 10 units of MPH. Now that I'm in my client's room and I have everything that I need, I'm going to assess her for her allergies, make sure I know her name and date of birth. And also, looks like she had this last time on her left lower quadrant. Now we can put it on the right upper quadrant. So I've cleaned it off, I've let it dry. We're going to do this at a 45-degree angle. We're going to pinch the skin a little and 45 degree. Not need to recap, we can just put that inside of the sharps container. Alright, we are going to then chart, perform hand hygiene, document the location that we've just administered this medication. As for the pen, we're going to make sure that we have the right medication. Okay, yep, this is the right medication. We're going to make sure we check the expiration date. Okay, not expired. And then we're also going to make sure that we have enough medication in the vial. Okay, we've already performed hand hygiene. We're going to clean the top of the vial for 30 seconds. Okay, we are then going to open our needle like that and cap that on. Okay, making sure it's nice and tight. Then we're going to dial our pin back to 2 units. We're then going to prime upwards. Okay, and then we're going to dial to 3 units, and this is the patient's Humalog. So we have the right medication. She needs 3 units of this. We're checking this to make sure with the nurse. All right, we're performing hand hygiene. We're putting on our gloves. We're assessing the patient for allergies, and we also have already checked her blood glucose levels. Now with that, what we want to do is we want to also make sure where she got it last. We want to make sure we verify that. Okay. Going to uncap, pinch the skin, not too much, but just a little. Okay, we're going straight down, making sure we hear that click. 1, 2, 3, 4, 5, 6. Okay, and being sure that we recap this. Throw this into the sharps container. Okay, and that we also are cleaning off this before we put it back. And then we're also going to document which quadrant we gave this in. We're going to perform hand hygiene, leave the patient in a comfortable position, and that will be the end of this video.